The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jarrett Chapman of Living Well joining us. Dr. Chapman, it is wonderful to see you.
It's wonderful to see you, Shay.
So today we're going to talk about radial cheek lines
hmm
and some of the ways that you can treat those.
Yeah.
And what
So
are radial cheek lines, first of all?
that's exactly what I was going to go after because we call these radial cheek lines. Patients come in and they see the line starting to come down the lateral portion of the face into this lower area that's just lateral to the mouth, and sometimes they can extend all the way down from where the cheek and the temporal fossa kind of intersect. And a lot of times they think this is being created from lateral canthal lines or from what we call crow's feet, that
Uh-huh.
it actually has nothing to do with that. It's volume deficit that's occurring in the mid face and even down into the lower face. And we're seeing also tissue texture changes of the skin. So when patients smile, they have these multiple creases that come out all the way up the face, with some of them getting deeper. Sun damage can make this worse. Just when you smile, naturally you're going to have an expression of the skin through here. So you start to see what we call these radial lines that kind of radiate out from the mouth up to the side of the face.
Oh, I see.
Um, with Velour, it's a very soft filler. It has a hyaluronic acid concentration of about 17.5 milligrams per ml. So a little bit lower than our Voluma and Velox that we use for mid-face volume replacement, and jawline definition. But Velour kind of rests a little on the lower scale of cohesivity, of G prime. So it allows a very nice filling effect for these superficial lines that occur in the face and around the mouth. The FDA approved it for fine lines and wrinkles of the lower face. And so we're staying on label by using this in what's called these lateral radial cheek lines. And it really does help with that area right in here to really just kind of stabilize that, soften it. It's not going to take every single line away, but definitely
Right.
is going to improve that area. I get asked a lot, what can I do for these lines out here? Well, Velour is the answer. It's a very simple procedure. We go in somewhat in the mid dermis, which is a kind of a superficial injection, and we lay that. And I have a technique where I cross hatch it into this area, meaning I inject down and laterally, and that just shores that area up. Takes about 2 to 3 minutes to do each side. There's little to no downtime. It's a relatively safe procedure in this area,
Mhm.
and patients do quite well. Minimal bruising. If there's anything that's going to occur, that can be covered with a concealer. And usually after about 2 weeks, the product has integrated into the tissue and you have a nice smooth effect. You can get some swelling in this
Mhm.
area because you are working two different directions on the injections,
Uh-huh.
and it will swell a little bit. But other than that, it's a pretty low downtime, very successful correction of this prominent problem that I see in the population.
How long do the results typically last?
It lasts about a
You'd
year
say
to 18
about a year. Okay.
months. Mm-hmm.
That's that's pretty good. That's
Yeah,
pretty good.
it
All
it
right.
is. Yeah. The
Uh,
areas, it's more dynamic than some of the other areas. It moves a lot. So I would say err on more of the 1 year point,
yeah.
than the 18 months. But the product is approved by the FDA for up to 18 months in the fine
Gotcha.
lines and wrinkles of the lower face.
Well, hopefully we're all smiling a lot, right? And that's what
That's
makes that
right.
wear out a little quicker. So,
That's right. Yeah.
all right. Dr. Chapman, thank you so much for being with us.
And thank you for having me.